Welcome back to the midweek edition of City News. How often have you gone to go to the toilet and you haven't been able to? It is a nasty condition. It is called constipation, and we are talking about it on today's show with resident GP Dr. Cate Mills. Welcome.
Hi, Steve.
So,
Hello.
tricky thing to talk about, but important to talk about it because it can be nasty.
I think it's one of those things that people don't often talk about and feel reluctant even to talk to their GP about until it's really desperate.
So, what is the problem?
Well, the problem is really that it's a slowing of the transit time from the food going into the mouth to it coming out the other end. And it can be, people can experience that in lots of different ways. So they may find that they don't go to the toilet as often to pass a bowel motion, or they, when they do go, the stool is very hard and difficult to pass. And sometimes it can be quite uncomfortable in the tummy as well. So sometimes people actually present with tummy pain from constipation, even without a great deal of awareness that they are constipated.
And it's something that can be very, very easily fixed.
Easily fixed.
Easily fixed.
Absolutely. Yep, there are lots of different treatments for it, many of which you can buy over the counter in your local pharmacy, and it's worth going just to talk to your pharmacist about what you might need. But in general, just some simple lifestyle measures will help with it. So increasing the fibre in your diet, so lots of fruit and veggies and grains and cereals. Increasing your water intake, so making sure that you're getting enough water, and exercise also helps. So some very simple things that will help keep your bowel really regular.
So if it is a regular problem, like if it occurs for you quite often, does that point to something else, or could point to some other problem that you have?
Yeah, it's really worth thinking about. It can be part of another problem. So, for example, there's a condition called irritable bowel syndrome, which would be really good to talk about one day as well, where the bowel can sometimes just be quite upset and have very unusual patterns of the way that it works. And one of those patterns can be that you can be constipated with that condition. But lots of other conditions have constipation as part of them as well, like the thyroid disease that we talked about before, celiac disease. So there are other conditions that you really would want to just have a check-up to make sure that you don't have any of those, and also thinking about, whether there could be something in the bowel that's actually obstructing the flow of the material through it. And certainly if somebody came to see me and they were in their 50s and they had new onset constipation after the age of 50, I'd really be thinking that that person needed some investigation.
Okay. How does the bowel actually work? It actually moves, doesn't it?
It's amazing, yeah. It has this wonderful coordinated contraction from, if you imagine it as a sort of very, very long tube, theoretically, and there's this wonderful waves of peristalsis, we call it, where the muscle around the wall of the bowel contracts and relaxes and contracts and relaxes to move the material through the bowel.
It's incredible, eh?
It is amazing. It is amazing, and one of those organs where we just kind of take it for granted that it does work well until something like this happens. So,
and what I mean, is there an average time for it to go in and come out?
Oh, varies.
Varies
really, absolutely variable. For some people that could be less than 24 hours, and other people that may be some days. So everybody has, a different bowel rhythm, if you like, around that.
So when people talk about, or your GP may ask you, do you go regularly to the toilet?
Yeah.
What is regularly? Should it be daily? Should it be?
It doesn't have to be daily at all. I think the question is really just, a better question might be, has there been a change to the regularity with which you go to the toilet? So if you're used to going every day, and then in the last week maybe you've only been twice, then clearly, that's a change for you. Whereas somebody else might only go twice a week, and then all of a sudden they're going, every day, and again, it's an alteration.
It's the change more than...
It's the change more than, what constitutes normal. So for some people, for children even, we've seen them go many days without pooing. And then gradually, as you get towards 7, 8, 9 days, that becomes very uncomfortable for them. And so yes, even children can get constipated.
And is it, I mean, if constipation is left or it happens too often, is there a chance that it can damage the bowel as such?
It's not really a dangerous condition in the sense that some of the things it can do aren't life-threatening at all, but it can cause quite a lot of distress. It can cause quite significant tummy pain. It can cause hemorrhoids. It can cause bleeding from the bowel. It can cause things called anal fissures, which are nasty splits around the anus, which are very painful. So some of the complications of it can be quite unpleasant. And then, of course, there's looking into, well, why are you constipated? And, of course, some of the conditions that can make you constipated could be dangerous for you, and those are worth sorting out.
But in the first instance, go and see your GP. Don't be ashamed or afraid to talk about it, because it's a natural thing and most people get it in a lifetime.
Yeah.
And very easy to counteract.
Very easy to counteract.
All right. You come back later in the week, eh? And we'll talk about how to take your medication.
Excellent.
Is that a good idea?
Great idea.
All right, done. After the break, Spark Volunteer Coach of the Year Awards from Sport Bay of Plenty. We have a chat with Dave Clark next on the show.